morning. I'm Emily Hathcock, Executive Council Post-Secondary Collegiate Vice President for HOSA-Future Health Professionals. Today, I am delighted to host HOSA's Executive Interview Series. This series is designed to deliver high-level industry insights to the HOSA classroom and invaluable mentoring advice to each member's college, career, and life exploration. To learn more about the series, upcoming guests, and how you can participate in future interviews, please visit our website, hosa.org, and follow HOSA's and our Executive Council officers' social media. Today, we'll be discussing about health disparities. While this topic has been widely discussed for years, it has been catapulted to the forefront, unfortunately, as COVID-19 has disproportionately affected communities of color, as well as rural and economically disadvantaged communities. I'm honored to speak with Ms. Joy Harris, Director of Research Integration, and Ms. Ashley Brown, Director of Health Equity and Stakeholder Engagement, both with one of the nation's most respected health nonprofit organizations, the American Cancer Society. Ms. Brown, will you take a moment to explain what health disparities are and why it's so important to address them in our healthcare delivery system?
Yeah, happy to. Thank you for having me. So health disparities are a particular type of health difference that is closely linked with social, economic, and environmental disadvantage and other characteristics historically linked to discrimination or exclusion. An example of a health disparity is despite historically lower incidence rates, Black women are 40% more likely to die of breast cancer than white women, which is unacceptable. We know that what drives health disparities are social determinants of health or social and economic factors such as access to healthy, affordable foods, quality transportation, and housing. And we have a moral obligation to address health disparities within the healthcare system. From an equity perspective, we believe everyone should have a fair and just opportunity to prevent, find, treat, and survive cancer. And quite frankly, disparities are costly. It's much more cost-effective to prevent disease than it is to treat it.
Thank you. Ms. Harris, you've worked in a number of different roles before joining ACS. Can you walk us through your educational and career path and what drew you to a career in health through nonprofit?
Well, first of all, thank you for having us, Emily. It's a pleasure to be talking with you today. And I'm not that old. I haven't had that many jobs, but no. I have had a few, and it's all kind of organically brought me to where I am. But after college, I ended up going to get my master's in public health at Emory, but I didn't go right away. It took me a couple of years to figure out what I wanted to do exactly. So it was not quite the path I thought. I thought I was going to go to medical school. That was what I was pre-med in college, and I was medical school bound, but it just wasn't my passion. So ended up going to school to get my master's in public health, loved it, and then worked from there at the American Red Cross. Had a great experience there. Then after I had my kids, I did a little bit of contract work for a youth leadership organization, working with middle and high school students. And then worked for a breast cancer organization, which led me to making connections with lots of folks at American Cancer Society. So it was a great step forward in my career. So that's how I got there. So it's been an interesting path, but a good one, and one that I can connect the dots. It's been very rewarding, each role that I've had.
Well, y'all both have made incredible impacts in your community, so I know that the people that you've crossed in your paths have been grateful to meet y'all and have the opportunity to know y'all. To each of you, knowing what you know now, what's the one or two pieces of advice that you wish a healthcare professional, personal mentor, or teacher that had told you as you were mapping your college and health career plans?
So I started off my career focused on health policy, so designing healthcare systems and policies that shape our healthcare system, like the Affordable Care Act. And most folks who are policy analysts work for the government, and they may stay there their entire career. We used to call them lifers. But I wish someone had told me that there are a number of things you can do with the skill set that you have for public health and healthcare. And you should try, while you have the ability, to intern or try many different roles and learn from folks with varied experiences. I've done that in my career at ACS, but I've done that previously through other jobs as well. Just learning from different leaders and the types of work that they do, because there's so much you can do with the type of healthcare experience that you can get.
I couldn't agree with that answer more. I think too, for me, I mentioned that I was med school bound. So I wish that in college, as much guidance and great advice as I got, that someone had shared with me about public health, about healthcare management, about other opportunities within healthcare without being a clinician. And so, finding that thing for me, it took a second, but I'm so grateful I did. So I guess the advice I'd have too is to just find your passion. I don't think you can go wrong with that. And some people feel so compelled to know what they want to do right away, and you just may not know right away. But if you follow your path to take the right courses, at least you're on the path to doing something that will align with your interest. And I think that just learning, I think Ashley hit the nail on the head. Learning from each role, being involved with different things and different aspects, so then you can at least know, I don't want to do that, but I do want to go further in XYZ areas. So being open.
Now, Ms. Harris, from a research perspective, what do you think ACS can learn about health disparities and other critical health issues from working with organizations like HOSA?
That's a great question, Emily. I think the ACS is our research teams are doing a really great job with health equity and health disparities research right now. As Ashley pointed out earlier, we have, I don't know if you know, but we have several components, aspects of research that we work with, including data science and population science, looking at prevalence and incidence rates of disease. We also have grantees that we fund externally, our extramural grantees that are working on all kinds of questions and answers. So, we were able to attack this, these questions and issues from different angles, if you will. So I think that what can we learn from HOSA? I think just looking at your membership encourages and inspires me. You are all from different walks of life, different ethnicities, and I think it's just wonderful to see a member base so diverse and representative of our world. And if we can learn anything, it's just reminding us that research, not that we even really need to be reminded, because it's first and foremost on our minds at ACS, but I think that reminders that this is what our world looks like, and that research needs to be inclusive, and that we are mindful of all of the people and genealogy and everything that goes into finding the right answers for all communities.
I agree with you. That was one of the reasons I fell in love with HOSA, is just being able to meet people from all walks of life and have the opportunity to learn about people from different places and people who are not like me. So I agree with you. Ms. Brown, as you may know, HOSA has over 255,000 members across the United States and around the world. What role can our members play in helping the ACS address these critical issues in the communities we both serve?
The first thing you can do is to volunteer for ACS, or our advocacy arm, ACS Can, to improve things like access to care. We have a specific volunteer body for millennials and Gen Z that really help influence our strategy here at ACS, so they're important. So that's the first thing you can do. If they are of appropriate age, we know the holidays are around the corner, remind your family members to get screened for cancer. The holidays are coming up, and we know that although we may not be physically together, we can show our family and friends that we care about them, to make sure they are going to the doctor and getting screened for cancer. This is especially important now because we know a lot of folks are delaying care because of COVID-19, which is increasing disparities across the cancer continuum. And the third thing I'll just acknowledge is that you should get involved in your community. I mentioned at the beginning of this interview that disparities are created by the social determinants of health. So getting involved in your community, making sure that you understand what housing, transportation, access to healthy foods, what do those things look like in your community, so that we know that everyone can have a fair and just opportunity to prevent, find, treat, and survive cancer.
Through my experience with HOSA, I've become focused on my career path in public health and advocacy. So that's one of the reasons I'm really glad to be with y'all today, talking about such an important issue. I know that ACS is deeply involved with advocacy. Can you talk about how that works and how someone like me could become a public health advocate or a better public health advocate?
I think what I was going to say is I can tell you'll have no problem with advocacy, Emily. I mean, I think, I think we're all taught to, well, hopefully, we're taught to advocate for ourselves, and even little ways along the way, whether it's, going to a teacher and saying, I think I got this question right, or can you please reread this paper, or whatever it might be, to advocate for yourself. And those are things that the skills and tools that you learn along the way that will equip you to be a fantastic advocate for ACS and even other organizations. So, I mean, I have, there's been a few things that I've been found extremely rewarding in my job here. And I should also mention I am a breast cancer survivor. So I was diagnosed before I started working for ACS. So coming to work here and learning all of the parts of our mission that really helped me through my journey has just been more than priceless. So I just want to say that, but I'm mentioning that because one of the most wonderful experiences I've had is going to our ACS lobby day in Washington, D.C., and spending some time with advocates from all over the country. Everyone has a story, and everyone has a compelling reason why it's so important for them to be there, whether it's a personal experience and or an experience being a caregiver. But it is an emotional weekend for myriad reasons, but just to be there and to see the passion and the commitment and the plea for help, and in a very intentional way, people are going to speak with their legislators and asking for things that are important to all cancer patients. So I don't know if I'm answering your question. What I'm saying is there's such a need for strong advocates like you, and people that are not afraid to share their story, their voice, and in a very deliberate, strategic, bipartisan way. So I think that I can already tell you have the skills and to just do a great job with that. And I can imagine knowing the HOSA membership in the executive leadership, executive council. I mean, that all of you would be fantastic. I'm very glad that you are our future in that.
What really stands out to me is their access to care work, increasing funding for cancer research and preventative care and diversity, and then in clinical trials, which is really important. They recently helped get Medicaid expansion in a number of states, including Oklahoma, so folks can get their cancer care covered. They fight for funding for programs like the National Breast and Cervical Cancer Early Detection Program, which has provided low-income, uninsured, and underserved women access to timely breast and cervical cancer screening and diagnostic services. So they do a number of work. They do a lot of work like this, but you can simply go to fightcancer.org and sign up to be an ACS CAN volunteer and go to that lobby day that Joya just mentioned and fight for those important causes. And I know that you, Emily, and other members of HOSA would be great advocates.
Well, thank y'all both. I think advocacy is super important, and I think it's more important now than ever to be able to stand up and, fight for other people and to be able to make a difference in our community. So one of my personal favorite values in HOSA, and one that I've certainly experienced through my experiences in HOSA, is the value and importance of being part of something bigger than yourself. Can each of you speak to that from your personal point of view and ACS's mission and values and culture?
But I think being part of something bigger than yourself is just a concept that I think we should all just adopt and embrace. I think about, like I just kind of already alluded to feeling, to being able to work at the American Cancer Society and how thrilling and rewarding it is, because I was, from a personal experience, was able to utilize some of our mission. I mention that just because I feel like working here, I'm part of something bigger than myself. I feel like being able to give back, knowing the mission areas, research, advocacy, programs and services. It's so vitally important to cancer patients throughout their journey. From the treatment, knowing that ACS funded some of the research that led to a drug that I took was just like, wow, I'm here now, I'm part of that, I can help. And just listening to the conversations that happen in our peer review committee meetings, where researchers or scientists are coming to discuss these applications that we get from brilliant minds and brilliant scientists, and knowing what goes into the decisions that are being made about who to fund. It doesn't get much more exciting than that, to know that you're just witnessing something that is bigger than you and that could have impact long term, so and being a part of the programs and services, or knowing that we're offering different things to patients, and cookbooks and nutrition. I mean, stuff that you may not think about offhand, but that is so important. So I don't know how to even answer that. It means a lot to me, as you can tell. I'm very passionate about it. Ashley mentioned also the breast and cervical cancer program that ACS CAN contributed to. That's a program that I actually was able to utilize. I mentioned working for a youth leadership organization. I was doing contract work when I was diagnosed, and I met the criteria, the eligibility to get services. So you can imagine when you get a diagnosis like that, I was wondering, how am I going to pay for this? And it just so happened that I was able to get insured through that program. So gratitude beyond belief to the people that work to make that happen. So I don't know, I think I'm taking your question all the way to the other side, but I guess what I'm trying to say is, just working here, I feel like I'm part of something bigger than myself, and knowing that cancer patients and their families can benefit over time just makes me feel really good.
Yeah, and I'll just add that I've always chosen roles where I can make a big impact, and that it's focused on improving health of those impacted by disparities. And disparities and equity work is really a team effort. Like, you can't do this work alone. It takes listening and letting folks who are most impacted by disparities take the lead, because they often have the solutions. And at ACS, we're all focused on fighting for a world without cancer. So we have one mission, and that's it. And that we really coalesce around that mission. So everything we do is toward realizing that goal. And to me, that's really important. I've worked for other organizations, and we're focused on a lot of different things, but at ACS, we have one mission, and that's it. But equity work in this space is so important. I had a former boss who used to say, every time there's a breakthrough in cancer, more disparities are created. So it's really important for us to work together to identify those disparities, listen to the folks who are most impacted, and then uplift those solutions.
Well, Ms. Harris and Ms. Brown, on behalf of HOSA's 255,000 members, thank you so much for your time and a truly fascinating discussion. We look forward to continuing our dialogue with you and your colleagues in ACS to develop future health professionals that will solve the difficult problem of health disparities in our healthcare system. To learn more about ACS, how they lead in the fight against cancer, and the work to address health disparities, please go to www.cancer.org. And to watch this interview again, read or watch the full-length interview, share it with others, and learn more about the series, upcoming guests, and how you can participate in future interviews. Go to HOSA.org or any of HOSA's social media. Please also follow me and all of our Executive Council officers on Twitter, Facebook, Instagram, and LinkedIn. To learn more about Ms. Harris and Ms. Brown and the American Cancer Society, again, please go to cancer.org. Follow ACS on Facebook, Twitter, LinkedIn, and YouTube, and follow Ms. Harris and Ms. Brown on LinkedIn.